Hi, everyone. My name is Inga Lennes. I'm the Senior Vice President for Practice Improvement and Service Excellence, and I'm here today with Dr. Kerri Palamara, who is the Director of the Center for Physician Wellbeing and a primary care doctor at MGH. So welcome, Kerri. It's great to see you. I hope you're well.
Thank you for having me.
We're going to talk today about COVID testing for patients and give some updates on some of the things that are going on. But I invited Kerri here because I specifically wanted to start off and ask her about what it's like as a primary care physician managing some of this with patients.
It's definitely getting very busy as a primary care physician. Our offices are getting inundated with phone calls from patients who are concerned about testing because they want to be around family members, testing because family members or themselves have been exposed, just worrying about COVID and thinking about travel. There's so many different things that people are calling and worried about. And I think a lot of the primary care offices are just feeling that stress of all the phone calls, knowing, and then you see cases going up and you just start, it's like, what's coming? And I think for many people, just thinking about how can we get the patients the answers they need in a timely manner that feels comfortable for them. And that's really challenging, particularly when it's not Monday through Friday, 9 to 5.
Right. Well, there's a couple of things that I can share with you. First off, I want to make sure that everyone knows that it's not just primary care doctors that can order COVID testing for patients. Any provider within our system can order a COVID test and then have their own scheduling team schedule the test at one of 16 different testing sites across MGB. So about a month ago, we decentralized the scheduling of testing, and we've now trained the schedulers in practices to be able to do that for you and for the patients. This allows sort of COVID testing to be incorporated into the routine care that you're providing your patients without having to rely upon an outside group to do that scheduling. But it is really important to know that you don't have to direct patients to their primary care doctor. If you as a specialist receive, a call or a concern from a patient, you yourself can order a COVID test. And as an oncologist, I do order COVID tests for my patients. So, and then my team schedules them, or my clinic team, just like my radiology orders and other things, they schedule those tests in one of those 16 places. And then you mentioned the weekends. The weekends are tough. We used to run more scheduling practice, centralized scheduling on the weekends, but and we still are collecting nasal swabs on the weekends, but we're not calling patients to schedule that collection on the weekends because we don't have scheduling help necessarily during that time. But we do have access to, like I said, 16 centers across MGB, and we'll be sending out the link and we'll put it in this particular video. Those centers have partners urgent cares as part of the group. Those urgent cares are available on the weekends for patients to both be evaluated and for the partners urgent care providers to order the test and for the test to be done on the weekends. If you have a particularly urgent or anxious patient, that's an option for them.
And so they can go to a partner's urgent care site, get tested, get evaluated, and all without any order from their primary care physician or specialist's office.
Yes, and we started putting that link into the ambulatory news, and we'll be sending it out on Fridays to get the teams that are on call over the weekend that information, so that when they're counseling patients over the weekend, they can they can have that at their fingertips. Like everything else, if it wasn't urgent and the patient said that they could wait and you want to put in an order and then have your scheduler call the patient on Monday to get it scheduled, that's an option. But if they just can't wait, then there's the urgent care available to them.
And so is that the way, as far as the way COVID tests get scheduled here, is it all through your office scheduler, or is there any centralized scheduling process that's happening? I think there's been some confusion for people there.
So we're working on decentralizing all of the COVID scheduling. So the last group that was not decentralized was the pre-procedure groups. So we had a central team that was doing a lot of pre-procedure COVID test scheduling. And we heard strong feedback from those primary procedural groups that they wanted to take that on because they were calling patients anyway to schedule their procedures. So the last group to sort of unwind that is the pre-procedure group, but we're in the midst of doing that now. I think the need to schedule a test is something that is likely to change soon. So one other thing that's coming that I want to let everyone know about is the ability to self-schedule. So patients in the future, hopefully in the near future, we're thinking about a month or so, will be able to schedule their own tests through Gateway. So if they have a Gateway account and they meet criteria for self-scheduling, they'd be able to get on. So this cuts the scheduler out of the equation, and that will be great. It will be a lot of relief to our scheduling teams.
Excellent. And so as a clinician ordering a test now, I can assume if I can put the order in that the scheduler that I work with in my office will call the patient to set it up until the system is there for the patient to be able to do it themselves.
That's right. Yep.
And that over the weekend, if there's a patient who's anxious, they can go to one of the partners' urgent care locations and get that taken care of on their own.
Absolutely. Absolutely.
That seems a lot clearer.
Yes. So we really want to make sure that we're moving forward to first empower patients. There's many of these patients, like you said, are asking for these tests because they are traveling or because they need them for some exposure. And those patients, if they have a Gateway account and are able to do the work themselves of scheduling it, we should empower them to be able to do that and save the time of our schedulers to be really spent with people who need us to help get things done or are feeling ill or are more acute in some way. So we're really trying to empower patients to do some of this themselves and to use all the resources across the MGB system. That I think is the biggest message I can impart, is that it's not just MGH. There's lots and lots of places to get our testing, and we really want to spread that volume across the whole system and take advantage of the partners' urgent cares.
And is there anything in specific that we should know about for our patients or their families about getting children tested?
So we do have pediatric testing that's available here through the programs that we have always had, and our pediatrics group has been coordinating the testing that we have that we do for pediatric patients. If there is a patient that if there is an employee that has a child in their life that they're worried about, I always recommend that they go first to their children's primary pediatrician to get guidance on where to have those children tested. But we do have the ability to test children here at MGH. And most notably, there are many places across those 16 centers across the MGB system that also have capacity for children as well. So, so it's something to be aware of. And many patients over the weekend, they don't mind driving, an extra couple of miles to get to some place that is, and in some cases, the testing centers are actually closer to them, wherever they live, but to get to some place because they're really concerned with expediency. They really want it to be done right away. And so, again, I can't stress this enough, that link to all the testing resources across the whole system is really important, and we'll be putting that link in as many places as we can so that everyone is aware of it. Okay. Well, I want to thank Kerri today for being with us and talking about testing. I know that we'll be back to talk about many more things related to testing. I hope that everyone's keeping themselves safe and healthy, and I want to thank Kerri again for being with me today.
Thank you for having me.
All right. Take care.